Okay, so imagine this. Your patient refuses a pork-based medication because of their religion. And you say, "Oh, come on, it's just a capsule." Congratulations, you've just failed the cultural competence test and possibly lost your patient's trust. So let's talk about how to meet people where they are and not where you think they should be. You ready? Let's go. So what is cultural competence? Well, cultural competence is understanding and respecting a patient's values, beliefs, and practices, providing care that's not just clinically sound, but culturally safe, and recognizing your own biases so they don't interfere with the care that you provide to your patient. Here's an NCLEX tip. For a question that asks how to respond to a cultural belief that you don't understand, don't challenge it, accommodate it if it is safe, because safety is first. So what are some cultural considerations in nursing care? Well, we're going to break this down into two columns: cultural factor and nursing consideration. How about a language barrier? We'll use a certified interpreter, not a family member. Gender roles. Some cultures require same gender providers. Dietary practices, kosher, halal, vegetarian. You want to ask your patient before meals. Eye contact. Well, remember, this may be disrespectful in some cultures. Touch and space. Well, this varies, so you always want to ask for permission before doing anything to your patient's body. And religious rituals. These may include prayer times or sacred garments. So here's a funny truth to remember. If grandma won't let go of her rosary during a surgery prep, that's a nursing assessment, not a negotiation, because trust me, she's got good grip strength. So how do we treat the whole person? Because holistic care is part of our job. Well, holistic care means mind, body, and spirit, not just the symptoms that your patients are experiencing. Ask about the emotional well-being of your patient, the spiritual needs of your patient, and social support. Consider alternative therapies, herbal remedies, acupuncture, and prayer. So here's an NCLEX tip to remember. If the patient is using a non-harmful alternative therapy, don't stop it, don't judge it. Ask about it, then make sure you document. So often spirituality and end-of-life care is part of our discussions. So how do we do this well? Well, always offer a chaplain or spiritual support, even if you don't share in the belief. Respect dying rituals and post-mortem customs, and never remove religious items unless life-threatening and with permission. Scenario: a Muslim patient requests to face Mecca before death. What's your response? You honor that, period. No ifs, ands, or buts. So be careful to differentiate between cultural humility and cultural assumptions, because cultural competence isn't about knowing everything about everyone. It's about asking the right questions. Are there any cultural or spiritual practices we should be aware of to care for you better? Or say, are there any foods, medications, and treatments that you would prefer to avoid? Would you like someone from your faith community to visit? Here's a pro point to remember. It's okay to say, I'm unfamiliar with that practice. Would you feel comfortable explaining it to me? That's a very good sentence to make somebody start to trust and relate to you. So let's try out an NCLEX style question. Are you ready? A hospitalized patient requests a vegetarian meal due to religious beliefs. The nurse responds, it's hospital policy to serve the standard tray. What is the best action? Tell the patient you'll notify the dietitian. Explain that hospital trays are based on nutritional needs. Advise them to bring their own food from home. Ask them to reconsider since it's just a short stay in the hospital. Take a moment and write down your answer. In this case, the answer is A. Notify the dietitian. Patient-centered care means we adapt to the patient, not the other way around. So remember, here's a nursing gold nugget. Respect is the most powerful clinical tool you've got. Cultural competence isn't about memorizing. It's about listening, it's about adapting, and honoring each patient as a whole human being. So remember, the whole world walks into your hospital room. Different languages, different beliefs, customs, and different needs. As a nurse, your job isn't to know everything. Your job is to ask, listen, and never stop learning on your feet. Next up, we're going to talk about pregnancy and prenatal care essentials, because you never forget the patient who lets you care for them and their baby. Great job. Go do your exercises. I'll see you right back here for the next video.